County.
Hello and welcome to the Rogers TV COVID-19 show. I'm Carol Merton, and before I welcome our guest today, I want to share a few thoughts with you. On Thursday, January the 14th, 2021, as part of the declaration of the second provincial emergency, a stay-at-home order was issued. This order and other new and existing public health restrictions are aimed at limiting people's mobility and reducing the number of daily contacts with those outside of our immediate household. We are all now on the front line. We are all working together to stop this virus and also the variants that are coming from spreading. This virus will seek every opportunity it can to find a loophole and spread. Let's not give it that chance. This is hard work for all of us. It is hard to be isolated, and it is hard to have our daily routines disrupted. We're all weary. Essential workers in healthcare, long-term care and retirement homes, public first responders, pharmacies, our local businesses and support service agencies, and so many others need our support now more than ever as we move through this time together. On the horizon, there is hope. There's hope that the future vaccine availability will allow us to move through the priorities, and all who choose to be vaccinated will be able to receive it. Never underestimate the value and importance of what we are doing by following the Public Health Unit guidelines. The sacrifices that we make each and every day are helping to prevent the spread of COVID-19. We are saving lives. Thank you to the community for all that you are doing. And on that note, I also want to thank our first guest, as well as welcome James Scongack, who is from Bruce Power, who's joining us today to discuss more about COVID-19 initiatives. James, you've been on the program before, but I'd like to say a few things. First of all, your official title is Executive Vice President of Corporate Affairs and Operational Service at Bruce Power. Have I got that right?
I've been called worse, but that sounds right to me.
The reason I ask is in COVID-19, people's roles are changing and they're taking on different portfolios. And so I want to make sure that, I get it right. So the other thing I really do want to acknowledge is Bruce Power has been an amazing community support, an amazing community partner, and an amazing community ambassador. But I also want to give a shout out because I understand Bruce Power has been named to the Forbes list of Canada's best employers in 2021, correct? That's
right.
A significant.
Yeah,
that's significant.
We're really excited. It was absolutely great news. It's a reputable publication, and really a lot of credit to the team at Bruce Power, and really what we're doing. That was a pleasant surprise to start the day with.
The other thing I do also want to mention, I know you did not ask me to say this, but when I was doing some research, I also found that there should be a congratulations to you because you've been honored as a member of Canada's top 40 under 40 for your accomplishments, James. You've never told me that. And I want to say congratulations.
Thanks very much.
My pleasure. Big shout out to you as well as to Bruce Power. So let's get on with the program. You've got lots of information to share. Where would you like to begin first?
Yeah, no, great. And thanks very much for having me, and really want to thank you, Carol, and your team. I mean, I think the work that you have been doing throughout this pandemic is really important. A lot of our regional media partners and our local media partners in the community, I think, across Grey Bruce and the Huron and the broader region have been, a real source of I think, good information, factual information. You know, you've brought forward people like Dr. Era, given him a stage. You know, so folks can have the information, and with that information is power, and can do the right thing, as you noted. You know, I think one of the areas that, you know, maybe we can start with today is really the issue of vaccines. And, you know, this is obviously an area where, you know, I think all of us are impatient and enthusiastic, because I think we all know that the ultimate end of COVID-19 is a successful vaccination program that actually allows us to start getting ahead of this, like we see with other, you know, public health initiatives. And, you know, again, a real shout out to, I think, the Public Health Ontario, Dr. Era, you know, because I really think the Grey Bruce region has stepped up in a very unique way when it comes to being ready for vaccines. And, you know, yesterday, in particular, Dr. Era issued a press release that, I don't know if you saw it, but that Grey Bruce, in the coming weeks here in the month of February, is actually going to be receiving, I think it was 7,000 doses of the Pfizer vaccine. And I think what's really notable about that is we know that the supplies for vaccines have been a challenge. There's a prioritization of those. We don't make vaccines, manufacture them, produce them here in Canada, so we're reliant on international agreements. And, you know, really what I think is the untold story here from a Grey Bruce perspective is the fact that public health, we've been honored to be a part of it from a Bruce Power point of view, have really gone and ensured that we are positioned with the infrastructure to be able to accept Pfizer vaccines. You know, I think we're one of the few regions that, you know, we were able to help, along with Chapman's Ice Cream, to procure some deep freezers. And we're working on the mass vaccination hockey hub jointly with Dr. Era. And I think what's really important about that is, you know, we need to recognize there are things we can control in life, and there's things we can't control in life. And so if we think about our collective way out of COVID, as you noted at the start of the program, we can control our behaviors now and what we do to reduce the spread. And I think yesterday we had 0 cases in Grey Bruce. So we know that if we follow these things, we'll be successful. But I also think we can control how we're set up to be able to mobilize as a community in a region when the vaccines arrive, that we can administer them. So for me, that is absolutely important. And I think Grey Bruce is well positioned. You know, I always like to use a Bruce County term that we don't want to be the dog that caught the car. You know, we don't want a situation where Ontario receives plane loads of vaccines and they're not going in people's arms. And so as a community, I think continuing to mobilize around public health. Obviously, public health has an order in which people need to be vaccinated, and we need to trust them with that order. And I think being ready to do that, Carol, is really important. I think we've come a long way.
Now, you mentioned about Hockey Hub, but you have a role in, Bruce Power has a role in the Hockey Hub, especially in a couple of communities around the arenas. Can you discuss a little bit more and what that will mean for people to get that?
Yeah, absolutely. It's a really good question. So as you may recall, we partnered with public health back in the springtime to establish what were called recovery centers. Grey Bruce Health Services established a recovery center in Owen Sound, and Bruce Power, along with public health, established a recovery center in Kincardine and in Hanover. So what we're doing is we're working with public health to now modify those recovery centers to be mass vaccination centers. And, you know, the team at Public Health Grey Bruce have had done a really good job of creating this mass vaccination hub. You know, it doesn't mean there isn't going to be other ways that people will be vaccinated, but this is really a way of getting large volumes of people through. So, you know, what a great partnership to work together. The municipalities have been a part of it. And I think, I think there's also a dynamic here of public confidence, of showing people we're ready. When they arrive, we're ready. So I think it's really exciting. And, you know, Dr. Era has pulled together a task force broadly for Grey Bruce that we're happy to be a part of, along with many other partners. And what's really exciting about that is you have partners from all over the region coming together to say, how do we help? And everybody's
yes.
and we're in the same boat.
Now, there's also a unique partnership. Bruce Power has partnered with the Ontario Chamber of Commerce and Facebook Canada to launch a Vaccination Council. So tell us a little bit more about that. I know you have a significant role in that. And why was it formed and what's the advantage?
Yeah, well, really what the Vaccination Council, Support Council is really about is, this is more at the provincial level. So we're involved very actively in the Ontario Chamber of Commerce, given the role that we play in Ontario, and work collaboratively with a lot of other companies, large, medium, and small. And so, one of the things we talked a number of weeks ago now with Facebook Canada, their managing director, and also Rocco Rossi, the CEO of the Chamber, was, there was a tremendous amount of angst in the business community, as you noted, especially small businesses who, it's just brutal what they're going through. I mean, we know the reason why, but it's very tough. And there's a lot of people, I was say people's lives are on the line, but people's livelihoods are also on the line. And by doing the right things, we're protecting both. And so really the conversation was, we need to come together as a business community here in the province of Ontario, and provide the government and public health the things that we can do to help, right? It's what they have in front of them is not easy, right? They're waiting on vaccines from other countries. They arrive and there's an expectation they're deployed. And so we actually very recently, as this Thursday, there's approximately 200 companies of all sizes now part of this council. And on Tuesday of this week, we had a virtual meeting with Premier Ford, General Hillier, the Health Minister, and Solicitor General. And we're working closely with them to find out where is it they need the business community to help? What can we do? And to be honest, selfishly, with my Grey Bruce hat on, I've been using the model here as a bit of an example of how we can work how the private sector, how the community and public health can work together. Because I think for this to be successful, we're all going to need to work together.
Absolutely. And I think one of the strengths, certainly in Grey Bruce, is that we'll often be pioneers of new and innovative approaches and partnerships. And our strength is in our ability to develop those partnerships and networks that, on paper may not even look like they match, but in actuality, they do. Bruce Power's ability to provide the logistics and the supply chain knowledge is phenomenal and has certainly been an advantage to the community in this, dare I say, adventure. Not necessarily a positive adventure.
No, but I think, look, I don't think.
So you're involved in this.
No, sorry, I just want to raise one comment you made there. I think you're right. COVID-19 has been terrible, and we all know the reasons why. One of the things I do think that COVID-19 has taught us is there are areas we can come together in a very important way. So, to your point, Carol, it's a terrible situation that is, we've had deaths, we've had people ill, people losing their livelihoods. I also think there's a tremendous number of success stories in response to that tragedy and that difficult situation that have been great. And I think that it's going to be really important for us, while we're starting to all get a bit frustrated and fed up with this, to keep at our best and recognize we're only getting to the end of the tunnel unless we work together.
Yeah. And you said earlier in the program, it's hard to be patient, and certainly it's hard. I have a phrase, we're getting a little COVID cranky at this point in time. It's hard, but being prepared for when the vaccines come, I think emotionally and for people's peace of mind, that gives them confidence, as you said, to move forward. I'll talk a little bit about other ways that Bruce Power has contributed to the community. It's about the rapid tests that you re-donated back to the community for the Grey Bruce Health Unit to use. Can you talk a little bit about that?
Yeah, for sure. So back in late November, early December, the government of Ontario launched what I thought was a really exciting rapid testing program. And these are really rapid COVID tests where a nasopharyngeal swab can be administered. Nasopharyngeal is the swab that feels like it's coming out of your ear and goes in your nose, but it's an effective swab. And the government of Ontario, and Canada provided great leadership and purchased a lot of these. And they made them available to large employers who wanted to partner with them on the basis of testing has to be a really important element. And we were able to secure around 15,000 of these rapid tests. Bruce Power, previous to this, had launched a partnership with Life Labs and developed our own testing program on site. And by the time this government initiative came through, we were well down the path on the Life Labs test. But we weren't exactly sure, what route we would take. So what we decided to do is to say, continue with our Life Labs program because it's working out very well. Life Labs is actually owned by one of Bruce Power's owners, OMERS Pension Plan. Maybe there's listeners who are pensioners from the OMERS Pension Plan, and if you are my boss and Life Labs' boss. But we partnered with Life Labs, and they've done a great job of our testing, and we had a routine with that. We wanted to continue. So Carol, what we did was we worked with the Ontario Ministry of Health and Dr. Era to say, hey, we've got these 15,000 tests in Grey Bruce. Why don't we redeploy them? Instead of sending them back? And there was a great partnership. Ministers Walker and Thompson were hugely supportive, and it was just a great effort of coming together. And, testing is really important. And testing is one area in the second wave that I can tell you as an organization that we did not have in the first wave. On an average day at Bruce Power, we are testing doing 1,000 tests a day on our site. So, wow. Obviously we have about maybe around half of our employees working from home, but obviously folks have to be on site for, essential services work like operations, critical infrastructure work, and outages. Those folks, it's a voluntary program for most people, but we have about 1,000 tests a day. And I can tell you the amount of positive cases we have been very low. Just to give you an example, in the month of January, we did approximately 20,000 asymptomatic tests. We had about 5 or 6 positives. Now you want 0 positives, but that allowed us to reach people before they were in the workplace. So it keeps people safe. And also for the 99.9% of people who were negative, it gives them confidence that if you follow the rules you talked about and the things in the workplace, they can be COVID-free.
So as an employer, you're certainly taking the initiative to do the testing and make sure that people have everything in place to be safe and continue to be able to do the work. You have several campaigns that you have been involved in or initiated. One is the Be a Light campaign, and then also the Grey Bruce Huron Strong app as well. Where are you with those campaigns at this point in time?
Yeah, so the Be a Light campaign was an initiative that we launched back in November. It was a $1 million commitment that really looked at what I would call kind of a few pillars. We had public communications around reinforcing the public health guidance. Again, not Bruce Power giving public health advice, but really amplifying what was needed there. There was a lot of items around Christmas, food banks, and places like that, and mental health. And so those are all rolled out. That campaign will effectively be wrapped up at the end of the first quarter, but we really went aggressive in November because with these initiatives, there's always a period of time where you need to initiate it, and it takes time for the results. So we went very hard, very early, and worked with a lot of great community groups on that, and that will continue. The Grey Bruce Huron Strong, look, I give full credit of this initiative to a company called NPX Innovation. They're based out of Kincardine. We partnered with them, but they've really done the heavy lifting. And really what it is it's an app tool. We have, I believe, over 8,000 local residents on that app. And it has everything, there's been fundraising campaigns. It's got great public health information. There's something in there that I'm very fond of, a program in terms of a linkage with older folks who may be lonely in their houses. And if somebody wants to, offer to link up with a grandparent or somebody elderly who has nobody to talk to by the phone, it's just another online tool. A lot of people don't use the internet anymore. They use their phones. And so this was one way of doing that. If I'm not mistaken, I think we've had over 200,000 hits on that website and app. So it tells us it's getting used. And, we're also going to make that available to Dr. Era and Dr. Clausen in Perth, here on Perth Public Health Unit on vaccine information as well.
Was that, when you talked about that app, you call it Instagrams?
That's right. Actually, I have it right up here. It's absolutely, yeah. It's a great. It's an absolutely great app. So you can get it right. Oh, you won't be able to see on the screen, but you can go right on it, and it's part of. You can click on Be a Light campaign, and there's an Instagrams campaign. It's called Instagrams, and you click on that, and it can connect you. And I think that's one element that we can't forget about is, there's a lot of really vulnerable people, and I don't want to say that the only people that are vulnerable to COVID-19 are senior citizens, but I really think they make up the bulk of that group. And it's been lonely for them, right? It's really lonely. They can't see their kids or grandkids at Christmas. They, really hesitant to go out, and that loneliness is a big thing. And so, these are the kind of small things we can do that, just being there for somebody, knocking on their door, dropping off a box of cookies. It's really those small things that I think will get us through this last bit.
Absolutely. Another app that I'm familiar with that you've recently put in place, I believe, is it Feed Bruce Gray or Food Bruce Gray app? Maybe you can speak a bit more about that.
That's something we've partnered with respect to United Way, and if you download our Grey Bruce Huron Strong app, you'll see linkages to that on there. But that's just really about recognizing that our charitable organizations in the community that provide help to folks when they need a lift up and a helping hand, that food is a big problem. There's a lot of people using food banks, and it's not just, we always think about food banks at Thanksgiving or Christmas or Easter. There's folks that need the food banks all the time. And so this is really about helping with food security and, doing what we can to help out with that. There's some people that are out of a job, and while we can't control that for individuals who are working and have the means to make that contribution, I really think we're in one of those very dramatic situations in history that anything we can do makes a big difference.
For sure. And I think we know from the statistics coming about the use of food banks and around, those programs that feed people meals, the numbers have risen. And it's a wide variety of people. It's seniors on fixed incomes. It's young families where employment can be a challenge. So this is a good example of an opportunity to be able to share information. We haven't talked about the Isotope program in this show, but I'm wondering if you can fill us in a little bit. I'm glancing down. I've got lots of notes about what you're offering, so if you see me glance down, it's because I don't want to miss anything. Tell us more about the medical isotope program.
Yeah, absolutely. I mean, this is something we're really proud of. A lot of people, when they think of Bruce Power, they think of the electricity we generate, which is great. But, a really key area that we're very proud of is our production of medical isotopes. So we produce an isotope called cobalt-60. It's used to sterilize medical equipment. It's also used to treat brain tumors and breast cancer. And in 2020, we just wrapped up our isotope campaign for 2020 back in December. And through our isotope harvest, we provided enough cobalt-60 to the world. So this is not just an Ontario market. We provide about 1/3 of the world's cobalt-60. We provided enough cobalt-60 to sterilize up to 25 billion pairs of medical gloves or COVID swabs or medical equipment. So if you think about it at a time where, you see those vials on TV in terms of carrying vaccines, liquid, all of that's sterile. A lot of those components are sterilized using our cobalt-60, and the world really counted on it. We will be doing a very large harvest of cobalt-60 this fall. And obviously with the need around PPE, COVID swabs, and vaccination, it's in high demand. So it was something we were able to do. And I think it's something that as Ontarians, we should be very proud of. This is a major export. And if we didn't make it, there's very few facilities that have the kind of capability that we do to make cobalt at these volumes. So we're very proud of it. And we're actually looking to see what we can do to expand production over the long term.
So although we're dealing with a pandemic and all of the issues that are critical and need to be addressed, this program has long-lasting benefits post-COVID that will benefit communities and everyone in the future. And that's why you're considering expanding it. Is that correct?
Well, that's right. I mean, the one thing we know about global healthcare is we know that, we know diagnosis and treatment of cancer. We know those tools available to people that are impacted by that are expanding, which is a good thing. We know we have a growing global population, but we also know in countries that have high populations, as they try to grow their middle class and give, other countries give their citizens access to the same kind of healthcare that we've become very used to here in Canada, that's going to create a growing demand on these isotopes. And, Canada has historically and can continue to play a leading role in this. Bruce Power's a part of that, and we want to grow our isotope production because we believe, how terrible would it be that if we had new technologies to diagnose and treat cancer, but the limiting factor on availability would be isotope production. How terrible would that be? And this is an area Bruce Power can make a difference, and Canada can make a difference. And I always like to call us an isotope superpower, and we are. As Canadians, we're humble. Sometimes we don't talk about it, but we should talk about it. We should be proud of it, and we need to grow it.
For sure, because it will benefit so many people.
Absolutely.
And although our focus is COVID, I mean, there are other diseases out there that aren't going away, that are definitely present, that we need to address. So we have just a couple more minutes in the program. I know you've been so busy. You probably haven't had a chance to hardly reflect, but compared to the first wave and this wave, what's different for Bruce Power and for yourself in coping?
Well, it's, from my perspective, when I'm at my best and I'm having a good day, I'm an eternal optimist, but we all have those days where we think, is this going to ever end, right?
Yeah.
And I'll tell you what I think the difference is in the second wave, and this is going to sound very optimistic because that's how I am at heart. We can test for this in a way that we did not test in the first wave. We are doing 50,000 tests on average in Ontario a day. In the April, we struggled to do 10. We have a vaccine that is getting produced that we know that works. We know how to control this. Yeah. We did not know that in March, April. So what I would say is, how I feel about this in our last minute is, I think this has been tough on people. It's been tough on livelihoods, and we've lost far too many of our fellow Canadians. But there is truly light at the end of the tunnel. We know more about this than we ever did. In fact, when I look back at March and April, I'm like, how were we as optimistic as we were then? So we've got this. We know the way out of this. And I think we're going to come together, and I think we're going to look back and be very proud at how we responded to this.
James, it's always a pleasure to speak to you. Thank you for being on the program, and thank you to our viewing audience for joining us today. Please join us again to learn more about programs and services for you and for your family. Take care, stay safe. Thank you.
Great.
2 thumbs. And you take care. And please join us again, James.
This program is brought to you by Ignite TV. Now you're in command. Visit Rogers.com for more details.
Call the Rogers TV viewer response line. Email us or connect with us on social media.
Hi, I'm David Shearman, host of Politically Speaking. Join me for my next show where my guest will be Mayor Barb Klumpus of Meaford, Politically Speaking on Rogers TV.
Your mouth can do a lot of amazing things. And your